We are a group of co-production volunteers from Leeds Mind working on a suicide prevention project as part of the wider suicide prevention work in West Yorkshire. We all have lived experience of being impacted by suicide. We are speaking directly to staff on the front line and their managers and leaders about our personal experiences of secondary mental health services. We would like to share some of our thoughts about good practice in secondary mental health from our perspective of lived experience. We want to work with you so you can be informed of the impact of lived experiences to make the mental health system in West Yorkshire work in the best way it can for future clients and families.
The end of a session or a series of sessions are just as important as the beginning of those sessions. A clumsy ending can undo all of the good work that comes before it, leaving an individual with really negative, lasting emotions and feelings of everything that they've experienced through those sessions. It's so important to work with the individual to ensure that they have the skills to manage independently and know that they can access support afterwards. Staff need to be aware of the person that they're talking with, get to know them as an individual, their needs and their interests, get to know the people around them as well, their family, their friends and those that are important to them, and signpost them from there. Leaving an individual with lots and lots of leaflets and nothing else can be very overwhelming, and that person's not going to do anything with those leaflets at all.
We discussed what staff could do to support us at the end of appointments. Here is some of what we talked about.
So at the end of a session, one thing that staff could do to help would be to make sure that open questions have been asked to see whether they feel safe for the next 24 hours, whether they have support networks at home that can help them outside of office hours, and whether there should be a follow-up appointment if it's required, so they feel that there's something in place going forward for them.
To summarise, good support at the end of appointments is just as important as the content. Be prepared to follow up and take action. Signposting needs to be person-centred in order to work. All of this is key to building trust in the system.